All right, protocol 4 is our cardiac arrest pediatric protocol. No real change from your current protocols you're working under. It does break this down into neonate and child. So for your newborn to 31 days or less, you're going to exit to the newborn neonatal resuscitation protocol, protocol 42. If they're 1 month to 8 years old, this is the protocol you're going to use. Of course, for our I and P providers, consider bilateral chest decompression and traumatic arrest. And at any time, a return of spontaneous circulation, we want to go to the post-resuscitative care protocol for pediatrics, protocol 16. Protocol 5 is our epistaxis protocol, or a nosebleed protocol, and this protocol is broken down between whether or not your patient is a significant or multi-system trauma patient, and that's what's causing the nosebleed, or whether or not this is just a nosebleed that's actively bleeding that you can't control with direct pressure. So we're going to ask the question, is it significant or multi-system trauma? If the answer is yes, we apply direct pressure and exit to our injury protocol. If the answer is no and it's still actively bleeding, we compress the nostrils with direct pressure and tilt the head forward into a position of comfort. If that doesn't stop the bleeding, then we're going to go on to one of our new medications, which is Afrin. We're going to talk about that in a minute. All right, Afrin, or oxymetazoline. This is a vasoconstrictor. It's used to control or prevent nasal bleeding. So if the patient has active bleeding after direct pressure, after tilting the head forward, we can't get the bleeding stopped, all provider levels are going to have the patient blow their nose, and we need to suction the active bleeding. The purpose of this is to clear out any blood clots so that the medication can reach the blood vessel and constrict and hopefully slow or stop the bleeding. So for our adult patients, Afrin, 2 to 4 sprays to the bleeding nostril. For our pediatric patients, 1 to 2 sprays to the bleeding nostril. Now we want to avoid Afrin in patients who have a diastolic blood pressure greater than 110 millimeters of mercury, or they have a history of coronary artery disease. All right, protocol 6 is our fever protocol, and we will be breaking fevers that are greater than 100.4 degrees Fahrenheit or 38 degrees Celsius. Our EMTs will be administering to adults only ibuprofen and acetaminophen to do so. All right, so a new medication we're going to be carrying out there is ibuprofen. And for the EMT, this is adult only. But for all other provider levels, we will be administering ibuprofen to break fevers. This comes in a concentration mixed 100 milligrams in 5 mLs. So adult patients with a fever greater than 100.4 Fahrenheit or 38 degrees Celsius, we want to administer 400 milligrams PO. So that would be 4 medication cups, and these are about the size of a coffee creamer. And as I said, they come mixed 100 milligrams in 5 mLs. Now, we need to be on the lookout for NSAID-induced asthma. About 8 to 20% of all asthma patients can have an asthma attack when taking NSAIDs, or non-steroidal anti-inflammatory drugs. All right, so ibuprofen. It is a non-steroidal anti-inflammatory drug, and it has antipyretic qualities. Indication is a fever greater than 100.4 or 38 degrees Celsius. Of course, we're not going to administer this in the setting of environmental heat emergencies. Contraindications to ibuprofen are hypersensitivity, asthma, severe renal or hepatic disease, and our side effects are anaphylaxis, rash, GI bleeding, nausea, tinnitus, and headache. Okay, let's talk about acetaminophen. And for adult only, for our EMTs, but for all other levels, we're going to be administering Tylenol or acetaminophen to break a fever. So advanced up to paramedic can give this also to pediatric patients. The adult dose is 650 milligrams, and we've made this easy because it comes mixed 650 milligrams in 20.3 milliliters. Now this comes in a cup that's about the size of a yogurt container. All right, so if ibuprofen was previously administered, that's when we want to give acetaminophen, and vice versa, if acetaminophen was previously administered. Now, when we say previously administered, what we're talking about is the patient tells you, I took Tylenol or I took ibuprofen. We want to switch and give the opposite drug. All right, so your patient has taken ibuprofen, so you'll administer acetaminophen or Tylenol. And for the EMT, like I said, that's adult only. Adult patients with fever greater than 100.4 Fahrenheit, 38 degrees Celsius, and you have not administered ibuprofen or they have not taken ibuprofen prior to your arrival. Again, 650 milligrams PO. Let's talk about Tylenol or acetaminophen. It is an antipyretic and it is a non-opioid analgesic. Its indications, again, are fever 100.4 Fahrenheit, 38 degrees Celsius in the absence of an environmental heat emergency. Contraindications are hypersensitivity, intolerance to alcohol, saccharin, table sugar, and yellow dye, and that's how the medication comes packaged and mixed. Precautions are anemia, hepatic or renal disease, chronic alcoholism, pregnancy, lactation, and elderly patients. And our side effects are drowsiness, rash, urticaria, nausea, vomiting, and abdominal pain. Okay, so let's take a look at our pediatric doses for our advanced through paramedic providers. Ibuprofen pediatric dose is, they must be greater than 6 months old. It's 10 milligrams per kilogram PO. Of course, if ibuprofen was not previously administered by the patient or you. Acetaminophen pediatric, we need to see the color-coded list in the back of the protocols, the Broslow tapes, but the dose is 15 milligrams per kilogram PO.